Hi, I'm Dr. Sonia Doherty, ND, and I'm here with two of my colleagues, my sister, of course, Dr. Krista Doherty, ND, and we're super excited to have Dr. Jonathan Beatty, ND, with us today to chat about just being a naturopath, what that means to you. And I know you've been in practice in Port Hope for 14 years, and you did your undergrad at the University of Guelph, where Krista also went. Your focus was the nutraceutical science, and her background was biomedical talk. So it looks like Guelph is pumping out a lot of great NDs. And then now I think you're focusing a lot on autoimmune and neurological concerns. So we're just really excited to hear about, what you love about being an ND, and then anything you're up to or have been up to in the past that's helpful for our colleagues, because this is all about building naturopathic medicine and getting people access to the best information.
Perfect. Well, thanks for having me. And well, I've only been in Port Hope 2 years. And prior to that, I bounced around a little bit. So I started in Pickering right when I graduated. And then I had a kind of one of those wild moments where I had a 4-year-old autistic child brought to me for help with their gut. And when we started working on their gut and, figured out they had some food sensitivities, this nonverbal, low-functioning autistic child within 6 weeks was lost their diagnosis. Like one of those, if you have a commercial results not typical type cases. But of course, being in a special ed class with a bunch of other children on the spectrum, every parent, when they go to pick their kids up, started to notice, hey, this child, what did you do with that child? And so my phone started ringing off the hook for, okay, now cure my kid too. So I panicked and went to Chicago and did my DAN training. So at the time, it used to be Defeat Autism. Now I think it's MAPS, which is Members of the Academy of Pediatric Special Needs. And then when I came back after doing that course, I got networked in with a medical doctor in Markham who does biomedical intervention for autism, and started working with him. And I worked with him for a couple of years. And then I was just dividing my time between too many practices and got a little bit chaotic. So I left there, went to just a full-time practice in Pickering, then moved to Whitby. And then 2 years ago, kind of in the midst of the pandemic, I just, decided to really follow my heart. You only get so many turns around the sun. So my wife and I bought a farm, and we now have an 11-acre farm that we're trying to regenerate. So, I mean, don't give me too much cred as a biodynamic farmer yet, because right now we just have, it's more of repairs we've done to the place than we've got huge infrastructure yet. But, I've got some cows coming in 2 weeks. So we're going to become cattle farmers very shortly. We've got chickens, cool. And then a lot of it has just been, planting trees, building gardens, and just all the fun that goes with that. And that's just because my heart, I went to school originally, like everybody who goes to Guelph, to be a veterinarian. But in my studies of, in my studies of learning how animals work, in studying animal biology, we had to take nutrition. Go figure, in order to become a veterinarian, you have to learn about how food affects health. You don't need that as a prerequisite for medicine. And in doing so, I started looking at how food affected myself. I was the asthmatic, eczema, I had every lotion, potion, pill, puffer, you name it. I was on it. In high school, my eczema was so bad, they thought I had flesh-eating disease for a while. And it turns out I'm just that allergic to cow's dairy, and my part-time job at Dairy Queen was probably not super conducive to my health. The irony of that one's not lost on me. But I started messing around with my diet. That's what led me to naturopathy. Was I kind of started to fix myself with diet in university, and I went, okay, this is what I want to do. I want to treat humans, and I got to treat. I want to use nutrition. I had never seen a naturopath. I did not really know what one was. There was a cute girl in one of my classes that wanted to become one, and that's literally how I heard about it, because I was flirting with her. And then, followed. Sorry?
You become a naturopath? Did she?
That's no, she did. Well, she didn't go to CCNM. If she did, I don't know. I lost touch with her, but she never went to CCNM if she did become a naturopath. But anyway, long story short, I just sort of jumped on the journey of naturopathy, and I've never gone back. And for me, I really study it as like the foundations of health. Like I'm a big believer, so much in medicine we get taught, it's all about like, here's the human form and here's all the disease states of it. But nobody ever looks at that biohacking, health optimization, or longevity, which is like, what are the habits and behaviors of healthy people? We're always kind of just assumed that everybody's like baseline healthy, and then everything is some sort of deviation from health to disease, and that we can fix that. But if you don't know what the habits and behaviors are of healthy people, if you don't know what kind of makes the person tick, like you're the blind leading the blind trying to get that person back to healthy. Like, and most of our interventions, and I kind of got into this, I figured this out pretty quickly, was, somebody with high blood pressure, poisoning their blood pressure back into the normal range is not medicine. Like that's not health. Like, hey, and then when we stop taking that poison, our blood pressure goes back up. So we haven't cured anything. Cool. So how do we actually cure that? So I started doing a lot more research that way. And then I really started to get into the longevity studies and then, some family history stuff. Like my father's mom passed away with Parkinson's. So I do a lot of neurological condition work, really in out of self-preservation. And, combining that with autism, then I got into a lot of neurodevelopmental disorders. And I'm also a big biohacker. So it's like, I don't wake up in the morning being like, oh, I'm 50%. That's good enough for today. Like if you're not 110, like, what do you like? Just shoot for the moon, knowing that I'm never going to make it. But you're either like my approach, and I try to condition my patients to this is if you're not working on getting better, you're getting worse. Like we have this idea that if you just keep doing what you'll do, you'll just stay healthy and nothing will ever change and you won't degenerate. But for me, it's like you actively have to be working on improving yourself all the time, or eventually you're going to degenerate. And that's what I structure a lot of my practice around. And then I'm now trying to teach other naturopaths about this. So I'm in the process of just putting the finishing touches on a course I created on foundational medicine, which is, like before we get into all the fancy, injection therapies and all the fanciest supplements, like, do you drink enough water? If you look at studies, like and you get various studies that give you different numbers, but it's like something like 90% of the population is dehydrated. Well, let's fix that first, right? Like if you, I don't know how much you guys know about construction, but basically, like if you don't have a proper foundation, your house, I don't care how cool and modern and funky and amazing and high tech a house you build, that thing's going to just shift and sink into the ground in no time if the foundation isn't solid, right? You got the Leaning Tower of Pisa in no time. And so for me, I'm always like, build that good foundation. And then honestly, the rest of it just kind of usually comes together. Like it's, I love when I get to do really simple medicine. Like the number of, chronic IBS constipation type cases you fix with, okay, by 9 a.m., drink a liter of water, and then by noon, drink another liter of water. No, that's it. Like that's just the end of the treatment plan right there. And so many of us naturopaths, and because the society's conditioned, in my opinion, to expect medication, that like, and we feel an obligation as naturopaths often to try to give more and do more. And especially in a society like being in Canada, where people aren't used to paying for their medicine, we have this idea that we have to like give them this high value for their dollar, which I believe you can do even if you just communicate to that person that like, look, before we make anything complicated, let's see if just drinking water will fix you, because that might be all you need. And sometimes it's like building those foundations. That's what creates the long-term health. And I always joke about being the anti-doctor doctor, which is everybody who walks into my practice. And this is my advice to all new grads. Look your patient in the eye and say, I don't want to see you. And people are like, what? It's like, if you keep coming back, I'm not doing my job. And I say this to patients all the time. And they're always like, what? Or after their first appointment, they'll say, oh, thank you so much. And be like, no. They're like, what? Like, thank me when you're better. And they're always like taken aback by that. And they're like, well, but I already feel better just being listened to. I'm like, that's cool. And I've told you a bunch of stuff that sounded super awesome today, I'm sure. But until you're better, I'm not done and I'm not giving up. And so that's kind of my advice to new grads as well is, and frankly, like School is to teach us how to learn. I don't know. I don't want to bash the school too much, but like what I've learned and what works was not something I was taught during school. It's very much, without getting too political, the medical industry requires sick people. And like the medical departments require sick people. And so a lot of our systems are structured to keep a constant flow of patients into the medical system to create constant funding and constant need. We do very little preventive, very little like medicine that way. And I find this with humans too, that, we will do all sorts of preventive maintenance on our car and spend all sorts of money on preventive maintenance on our car. But when you ask a human to do that to themselves, they look at you like you're crazy. And the reality of it is like, no, if you spent like half as much money on yourself as you do on your car to keep your car running, and you spent half as much time on yourself as you do on your car to keep your car running, you'd probably be a lot better off. And here's a kicker: when your car breaks, you can replace it. But when your body breaks, you can't. Like, you get one. So don't mess it up. And then myself, I have an autoimmune condition. So that also, and working in the autism community, that's kind of what got me into that side of practice. Because again, it's just an area that's horribly treated in Western medicine and typical medicine, because everybody treats the target organ. Like, you've got rheumatoid arthritis, you see the rheumatologist. You've got celiac disease, you see the gastroenterologist. You've got MS, you see the neurologist. All of those problems are with the immune system. Never do you see the immunologist. You're like, oh, well, my immune system's attacking and destroying my nervous system or my joints or my gut or my pancreas or whatever it may be. And then the doctor's just like, they send you to that and they're like, oh yeah, no, you're right, that organ is dying. And it's like, well, what are we going to do for the immune system? Oh, we'll shut it off. And that's kind of like, I mean, the worst part is nothing I'm saying is inaccurate. And so my approach is going like, how can we maybe make the immune system not attack you? And let's try that. And so that's the approach that I take in my practice, and how I sort of got into the autoimmune world, because I have an autoimmune condition myself. My wife has an autoimmune condition, and we're just trying to prevent that with our kids, really, is a big part of it.
Yeah, I mean, I almost feel I would say it's somewhat fortunate that there's no real drug for autism, right? Like, they try the stimulant drugs, they try the antipsychotic drugs, because there's so much stuff going on in the gut. A lot of times they don't work, or they bring on another problem that's worse. So we almost get lucky as NDs who are working with families with autism, because they often come in, they come to look for alternative care, I think, sooner than folks who might be now having those organs dying from autoimmunity. Yeah, the pandas thing it's shocking.
Oh yeah.
We look at the neurodevelopmental and autoimmune world crossing over, right? And there's just, oh, your kid's got tics, your kid's raging, your kid's destroying the house, they're hurting themselves, they're hurting other people, they stop sleeping, they're peeing the bed, they can't write their name anymore, they've regressed in school, now they're presenting with severe ADHD, and it's like, there's nothing we can do, or it's all neurological. And it's like, how is that? Like, that the number of families get turned away from even sick kids, pandas clinic or whatever, and they get no medical treatment. And for us, it's like you said, which I love, is the foundational medicine. The basics are phenomenal. I think a lot of us who are a little bit older trained with Dick Tom, and he was always like basic treatment guidelines, right? And at the school now, one of our dear colleagues, like Dr. Pasoda, she's teaching the interns in the pediatric shift, thankfully, basic treatment guidelines, like make sure you do the basics well. So I love that. I think that's going to be a great course for people. How are they going to be able to access that? Your course?
Well, it's going to be, I'm going to be launching it on a website soon. I've got that in development. So I'll be hitting all the I'm probably going to, advertise it through CCNM and some of the other organizations that way, just to make it available and accessible out there through some of those kind of like
so we can
services.
Yeah.
And I'll this, I guess, the underground network that is all of us alternative healthcare practitioners and all of us that kind of really strive to optimize ourselves and our practices. I mean, yeah, that's a big part. I mean, the pandas one gets me every time, because I've had I'm always floored when you do like an ASO titer on a kid and it's through the roof. And yeah, and then you send them to like their sick kids neurologist and they're like, oh yeah, no, pandas isn't a thing. And you're like, oh, I'm so wait, what? And it's
like, why did they put it in the DSM-5? Who's Susan Sweeto? How did this happen?
Or, well, my only prayer for them at those, like sometimes it's like you almost hope they get another infection that they get given an antibiotic for. And then, and sometimes, and then you just see the improvements. And it's like, I only say that because I've seen it a couple times where patients have been given antibiotics for other reasons. And then that helps. But
people too, because they don't usually get more antibiotics and then they have to seek out how to get the help. And then we can come in and, not be creating crazy biofilm. I mean, I've had pandas kids, unfortunately, they're on meds for a long periods of time, like, the 10 years or 5 years of rotation of diflucan and antivirals and, all the antibiotics. And it's like, this didn't solve it for Lyme, which is Chris's, one of her big areas of focus. The chronic Lyme world learned this lesson. You can't just kill your way out of chronic infections. All you're doing is breeding more chronic infections. So it's so interesting for us, I think, for me to talk to other practitioners treating complicated health issues, right? Because we do need the spectrum of naturopathic intervention. Like, we need people who are focusing on prevention. We need people who are focusing on, just the general pediatric stuff and sleep. But the cases you're taking, I mean, they're really complicated. So it's great for our medicine. It's great for
I know. I find it so interesting that way. And it's like, people are always, they ask me like what I treat. And I'm like, well, everything from, intractable seizure disorders to people that just want to be healthy. Yeah. And everyone's like, what? It's like, well, no, but, and I'm kind of known a little bit as like an autoimmune guy. And people say, well, I don't have an autoimmune condition. Can I still send, my family member, or can I still send? Like, yeah, because chances are they probably have one that they just haven't been diagnosed with. Right? I think it's something like the average time from onset of symptoms to diagnosis in Canada for celiac disease is 10 years. Like, it's just, it's wild what the big delay is between onset of symptoms and actually getting a diagnosis. And so the number of people that I uncover autoimmune diseases in blows my mind, and how prevalent it is. I mean, if you lump all autoimmune conditions together, it's the number one cause of death in North America by a long shot. Yeah. It actually beats doctors. So,
wild. Thought they were number 3.
I well, that's the thing. It depends on the study. I've seen number 1, I've seen number 2, I've seen number 3. I mean, the fact that we're in the top 10, pretty brutal. And I use the inclusive we always when I speak of this, because I always also say to patients, I'm like, look, the reason I kind of sound crazy and practice the way I do is I want to be part of the solution, not part of the problem. And that's like a big part of sort of what I do and how I approach it. And then, like I went to Guelph, and I mean, my background was nutrition and nutraceutical science. And I mean, I was working at the human nutraceutical research unit there, doing clinical trials. And then I was in the natural health products industry for about 12 years as a formulator. And so I've had a wide variety of experiences and insights into that. And like, I try to be, it's funny because I used to work in the supplement industry, but I also try to be the anti-supplements guy, which everyone's always thrown off. They're like, didn't you literally make those for a living? I'm like, yes. But the goal is that we can live our life without the need to add all this additional supplementation. It's just the reality of the modern world is like, we're so far removed from understanding what our bodies need that we ultimately end up supplementing to repair all of these deficiencies. One of the things I heard somebody say it the other day, so I'm stealing this quote and I don't know from who, but it was like, humans are the only animals on earth that don't inherently know what to eat. Like, when you start talking to your patients, you realize like nobody knows what they're supposed to be eating. And I find, but like every animal on earth knows what it's supposed to eat. It knows what it wants. Like, if I try to feed my dog the wrong food, she'll just sniff it and look at me and be like, I'm not eating that. And for whatever reason, like she'll eat a cardboard box if you're not watching her. But at the same time, she'll also, we found out she's allergic to pork in part because she turns her nose up at it. If it's the only food available, she'll eat it, but she'll generally kind of like sniff it and look at you and be like, really? Like, this is what I have to eat today? Like, and that's how we figured out my dog was allergic to pork, was she just inherently knew.
Yeah, we
And
don't know.
humans
We
were
don't know
out
his
of touch
patients.
with, no,
No.
no.
No. And this is not my area of expertise, but I've read that there's animals that when they're sick in the wild, they can actually find plants, right, that help them, and they'll eat those medicinal plants. And we're here not eating our medicinal plants and avoiding the healthy foods and eating
Yeah.
foods, and then wondering why we're all sick, right?
Yeah. Oh, orangutans actually make a macerated poultice for their muscles because swinging around in trees all day makes their muscles sore. So they find a specific tree, chew the leaves up, spit it into a paste, and massage it into their own muscles.
I might
Like
need that.
I was just going to say.
My kids play rugby. I might need that.
Oh, yeah.
They
Well,
love that on
it's
the
like
sideline, be chewing it up and then like smearing it on them.
right. Well, I mean, for me, that's like kind of, I'm a big essential oils guy. And it was funny because I used to be very skeptical because, well, there's not a lot of scientific research on them. But once I started using plant essential oils myself, like that was it. I drank the Kool-Aid. The benefit I noticed to the use of essential oils and especially topical use blew my mind. And then the coolest is when you see it in like babies and animals and things like that, who they don't really have as strong a placebo effect, and just the effectiveness of them. It's just one more thing. Like I always, again, I don't know where I stole this quote from, but it's like that idea that the absence of evidence is not evidence of absence. And like, I mean, when I got out of school, I actually I registered a business, evidence-based medicinals. And I was going to have this, like, I had a logo and I was going to make all these supplements. And I started to realize that like even evidence-based medicine, it's nice in theory, but there's this, it's kind of disconnected from what real medicine is, because it's this idea that, that we have these that science leads, or scientific studies lead us to absolute truth, when the reality of it is it's like, oh no, this occurrence occurs more than by chance. And that's really what statistical significance means. Does it mean it occurs all the time? Does it mean we understand why we're doing the things we do? No. All it means is that this intervention causes this outcome to occur more than by chance. And that's about what we know. And so we have to, I think, also put into perspective, like how we evaluate evidence and how we evaluate scientific studies. And my biggest thing for new grads is go to the source. Like when you hear things, read the papers, look at the methodologies, because the number of misleading studies masks where methodology is just abysmal. Like I think you can destroy 47 of the 50 studies on masks for COVID by looking at cycle length in the PCR test. And they use a methodology that basically means the outcome of the study is useless. And it's like that's it. Like if you don't create your study properly, what have I learned from that? Absolutely nothing, because the study was performed incorrectly. And you kind of have to become a little bit of a technical wizard on some of these things. But I mean, it's really going to the source and not just reading the results, not just reading the author's conclusion, because the one I've seen more than once where the author's conclusion is counter to what their actual results show.
That was the vitamin D study during COVID, right? They
Yeah.
said, oh, it work, and it's like, that is not what the study said.
I read it. I read it, and then I read it, and okay, all right, yeah.
And I read it, and the results are the opposite of what the discussion says is the opposite of what the actual results say. And and that's why I always encourage patients to go to that. I mean, I read one years ago. There was a study put out, and it was eggs are more dangerous for you than smoking for stroke risk. And if you looked at the methodology, it was kind of like this survey study, but what it was there was a 14-year difference in the age groups between those people that ate 4 eggs a day and those people that ate 0 eggs a day. And the people that ate, for some reason, octogenarians like to eat 4 eggs a day. I don't know what it is, but it was the average age in the 4 egg a day group was 84 years old. and the average age in the other group was 70. And the authors of the study did not adjust for age. They didn't age match. And as soon as you age match, not only were eggs not as dangerous as smoking, in fact, they seemed to have a protective effect. And so here, right, it was like the exact opposite of the author's conclusions because they performed the study incorrectly. They didn't age match the groups. And it's like, gee, are you more likely to have a stroke at 84 or 70? I wonder, could age be like, is age the factor there? And it's just one more of those areas where that, like, you know, if you're not paying attention when you're doing evidence-based medicine, you're going to fail. And it just takes, and of course it's overwhelming when you first get out as an ND, but it's just kind of like, you just start piece by piece. And, you know, like I laugh at when I get patients that I've seen that have seen me for years, and I'm like I still see patient number 2, like he's got file number 2. And I look at some of the stuff I used to do with him and I'm like, oh, I was such an amateur. Like I pretty much make fun of myself. And I even say to the patient sometimes, I'm like, man, the fact that you stuck with me all these years, like I'm amazed, because like I would have fired me back then. And he's like, yeah, honestly, I didn't know any better. He's like, knowing what I know from you now, but he's like, you were the first ND I'd ever seen. So it was better than nothing. And right. And that's that whole, like imposter syndrome that we get, that we're like, are we good enough? And what we forget is we're naturopaths. We've got like 8 years of, you know, post-secondary training and education. And we on average know a lot more than the general population. And, you know, and so even if you feel a little inadequate, you can still provide tons of really simple health advice that makes, and especially some of that foundational stuff, it makes dramatic, like the biggest improvements in patients that you'll see. And it's sometimes the simplest. It's like, we think we have to get complicated. We think it has to be super advanced and brand new and cutting edge. And it's like I find, you know, it's things like quercetin. I've been using quercetin pretty much every day for 15 years. And why? Because it works. And it's like, I've realized when I first started, the number of herbs and treatments and supplements I used was like hundreds. And now I'm like down to 10. Like I mean, it's a little bit more than that, but like I've really streamlined and figured out what works and what doesn't, and what's like a flash in the pan. And, you know, like raspberry ketones for weight loss. Okay, that was 1 week. Acai berry for weight loss. Okay, that was the next week. Green coffee bean extract for weight loss. Sorry, if we had a pill for weight loss, the person, like, I'm just going to invest in that, and I'll be driving my Ferrari down the coast of Maui. Like, let's call it what it is. There's not the magic pill. It's usually more to do with you know, well, you guys know, inflammation, lifestyle. Like, there's so many factors. But that's it. And then, I mean, my other beef is that white blood cells make up less than 20% of the immune system. Right? Like that's the big thing nobody talks about. And that you have glial cells in your intestine. And like, there's just so many things we don't get taught in school, like fascia. I don't know, like that's kind of a big deal. And then, right. And my other piece of advice to new grads is you don't need to be an expert in everything. Refer. Like patients, you know, they appreciate it. They just want to get better, whether it's you or somebody else. And so I refer to other naturopaths all the time when it's not my shtick. And then the other one, from a practice building perspective, is you start referring to all the chiropractors in town and all the acupuncturists in town, because that's all they do all day, every day. And sure, our license allows us to, but if that's not your absolute strength and what you want to devote your entire life to, just partner up with some people and just find some good people you trust and refer to them. And you'll find your practice grows faster doing that than anything else, because they'll just start sending patients back your way. And that was like the number one thing. That and joining networking groups. That was the other thing that really helped me grow my practice early on, was just because you learn how to, like most naturopaths get out into practice and they're like, I do, and then they just list everything, right? And it's overwhelming. That's not how the human brain works. Instead, if you're like, you know, meeting somebody, it's like, what do you do? And it's like, well, do you know anyone that has a child with ADHD? Leave it at that. And you'll attract all the patients for, if you want to work on ADHD, just say the one word over and over and over again. You get all the ADHD patients, because that's one that as soon as they have one item to look for, their brain can go to it. You give them 40 things, their brain goes, and it bobs around and it never lands on anything because it's, before it finds something, it's going to the next idea. So sometimes just understanding how the brain works too.
Amazing. Thank you. I mean, I think that the whole reason we wanted to start Exceptional ND was just to bridge this gap in knowledge between people who have, special areas of interest or been practicing for a while, who've thought through a lot of their practice strategies, and to share that, right, with our newer grads. But I know for me, I've been learning a ton just being part of this platform and having to keep more up to date on things that I may not see all the time. But thank you so much for coming and letting us chat with you today. Is there anything else you want to share with our colleagues or the naturopathic community?
Well, I don't know. I just say, like, thanks for bringing me on and let me rant and ramble today. I mean, I love a chance to just connect with other brilliant minds in the field, and everybody that's got like different approaches. And it's funny because, like, I don't know, I've referred to you over the years for I don't know how long, because you're the other, one of the other autism trained naturopaths around the GTA. So it's nice to actually like sit face to face and chat with you. And then, I guess I should probably drop the name of my course. This is the Functional Medicine Practice Blueprint. Because the guide, my other thing with it is I find so many courses are designed around like, here's an information dump. Like, here's the big junk of the, like, here's all the current research, and have fun trying to integrate like 72 new facts into your practice. And it's like people, they take away 2 or 3. And so I've really tried to like design mine around modules. So it's like 20, 30 minutes at a time with like some like really simple, like 3-4 takeaways from each kind of lesson on a topic. So that it's not overwhelming, but so that people can also like actually make changes and structural and foundational changes in how they practice. Because that was the one that I always found with myself. Like, luckily my wife was an intake clerk at Sick Kids. And so she changed my scheduling system for me. And one of the smartest things that she ever did was we put into my schedule isolated times for new patients. So if you want to be a new patient of mine, there's like a handful of times in a week that are reserved only for new patients. I only ever see new patients, then I never do follow-ups during that time. And if you want to be my new patient, you have to fit into one of those slots. And it just allowed me like more streamlined structuring of my daily schedule. Because I do 2-hour initials. Like, my initials are a long appointment. I know a lot of naturopaths do much shorter ones, because I find that it's like when you get as much background on somebody early, you're not like finding out something new about them like on visit 3, right? Where you're like, oh, I wish I had that piece of knowledge on day 1 because I would have done something about it then. And it's like I do the real deep dive on the person day 1, and like thorough. Like, I ask every question imaginable, even if they're just there for like high cholesterol. Right. And it's what's that? So that's always been my approach. And it's even funny, like having a background in nutrition. I mean, I went from, when I was in naturopathic college, I was a vegetarian, right, to I now hunt for perspective. So like I've swung from literally one end of the spectrum to the other. But that to me is being a natural skeptic, which is, I've always believed in like, we never can fully 100% know truth. I have a background in philosophy and ethics. I was going to minor in that in university. So the idea of like critical thinking and how we know has always been something I've chased. But it's this idea that as a skeptic, it's like you can sort of suspend true belief. And so for me, like I basically tried to prove that vegetarianism was going to save the world. It's going to be like the number one thing we can do for the environment and for our personal health. And then I ended up in trying to prove that I disproved myself. And I literally just basically swung back the other direction. Plus, I don't speak Spanish very well. So I was in Cuba and, like vegetarian. And they'd be like, yeah, that's vegetables. What are you talking about, dum-dum? And then I would eat it and like, what's that salty, savory? Oh, there's bacon in the salad. Because like in Cuba, there's pork and bacon and everything. So I finally went after my 3rd bacon bombing, I just was like, that's it. I'm going to the beach. I'm having a burger. And I honestly felt like Popeye drinking a can of spinach. And that was kind of the slippery slope back to carnivore style living. And I eat fruits and vegetables still, but yeah, much of what I learned about nutrition I've completely revamped. And here's the key. I'll teach you the secret of what the perfect human diet is. It's whatever's right for you.
Yeah.
I know. I wish exactly. And like everyone's always like, wait, what is it? What's it going to be? And it's like, it's different for everybody. And that's the thing. Like some people really thrive on some, and it's that excursion on like learning what you need for self and that idea of like truly individualized medicine. So yeah. So thanks for letting me rant and ramble today, guys.
No, I
loved it.
I think it's going to be awesome for our colleagues to watch, to get to know you better and check out your course, and hopefully, connect with you and refer if they have patients who you can help. So yeah, no, thank you very much, and have a great long weekend.
Yes. Thanks.
Yeah,
Thanks,
you
Jonathan.
too. Thanks so much. All right, guys. Thanks. Take care.
You too. Bye.
Bye.